Good morning, everyone. Today I've got Elena with me, and I must be honest, I'm so excited. Elena and Sandra, who hopefully you'll meet in one of our later conversations. Elena is one of our exciting, fresh, vibrant practitioners. She heads up the physiotherapy department, but as you'll hear shortly, there's a lot more that Elena offers. So let's start off with this, Elena. Tell us about your background. How did you get into the profession? Tell us where you've come from.
Okay, so I got my bachelor degree in physiotherapy in 2007 in Spain, and after I got my bachelor degree in nursing, I had my master degree in osteopathy, master degree in clinical and sport nutrition, and I got few postgraduate courses. Like for example, I am a scoliosis instructor, Pilates instructor, I do the lymphatic drainage massage, I have the certification, I do the assessment of the temporomandibular joint, that is all linked with the neck pain, after I will discuss about it. And I did dry needling, I know how to do also acupuncture.
So what you're saying to me is you've studied just a little bit.
Just a little
Just
bit.
a little
Yeah.
bit. Just a little bit.
With my age, as much as I can.
And so certainly when people come to see you, they're not just coming to see a physiotherapist, they're coming to see someone with a vast background in information.
Yeah. My main goal is to improve the quality of life of the patient, to improve the lifestyle.
And when you say quality of life and lifestyle, explain to us, what does that mean to you?
Quality of life,
Yes.
it means the human being, we are made for move, so we need to move people that they are not moving, they become sickness. Plus, for example, you will start to have cramps, to have constipation, to lack of motivation, so we have to involve the patient to move. Apart of that, we need to advise them how to eat properly. It's not just you have to eat chicken and vegetable, no, it's more than that. We need to customize and we need to give guidelines to the patient according with the problems. And also we need to restore the sleeping quality, stress. So there are so many factors that we have to pay attention according to improve the quality of life.
So let's just take it back a step. How did you get to join DHTC and obviously to bring this holistic approach to DHTC? How did that occur?
Yeah, so I am here in the Rehabilitation Treatment Center since 5 years.
Wow.
Okay, and I am running the department of physiotherapy. I am running the department of nutrition. I am doing Pilates session that is so linked with the movement. After I'm going to explain you if I can
Sure.
about that. Okay, and I am running the department also the nutrition. Yes.
Fantastic. And when you talk about a holistic approach, how do you start that with the patient? The patient comes to see you, and what I understand, patients will come to see us from a pain orientation.
Correct.
So how do you start to deal with the pain, and then how do you take it further from there?
Okay. First, I'm going to make sure or to clarify that the physiotherapy is not just ultrasound, electrotherapy, and massage. No, it's more than that. So when the patients are coming for us, is or either they want to prevent or either because they are suffering about pain. So when the people are coming and they are suffering about pain, we have to do an holistic assessment. It means it's not just if you are suffering about neck pain, I need to be focused in the neck. Obviously, yes, but apart of that, I have to do the assessment of the hip mobility, of the back mobility. It means we have to look for the restriction. So in the first stage, the patients are coming, they are suffering about pain, so our goal is to reduce the pain and reduce the inflammation process through osteopathy techniques, manual therapy, analgesic techniques, anti-inflammatory techniques. When the patient is getting better, the second stage will be to improve the range of motion through techniques. After that, we need to strengthen and we need to make the balance. But I want to make sure that the patient is involved of the treatment. It means our technique is not just passive movement. It's just I am working, but also you as patient, you have to be involved in the treatment. Sorry.
I think that's fantastic. And while we're on that, if there are questions that you would like to ask, I think now is a good chance to be able to ask anything for Elena. As you can see, she is well versed in many different understandings of health. So throw your questions as we go. Apparently there is a question, so let's have it.
One of our clients actually wants to know where are you exactly from?
I am from Spain. I am from south of Spain. I was studying in Toledo University. It's a public university, very prestigious in Spain.
So if you're listening to her accent is
Sorry
certainly
for that.
different from my accent. I must be honest. I think the accent is great. All right. So what I'm hearing is people come to see you for pain, but what we want to do is we want people to understand that their pain is simply just a symptom of perhaps something more than that.
We need to look for the restriction. Why you have pain? Why? Because probably you are sitting in front of the computer 8 hours, and after obviously you are not moving properly. So we need to improve that. You need to be aware of the restriction, and you need to be active in our treatment.
And why is that going to be important to a patient that it's not just about the pain?
Sorry?
Why is it going to be important to a patient that it's not just about the pain, that you're looking for the deeper cause? Why is that important?
It's so important to have an holistic way. For example, when the patient are coming to us, and in the assessment we say, okay, can you raise your hand, Okay, most of our patients, they are not conscious of the movement, and they will compensate raising the shoulder. So the compensation, it will provoke the pain. As physiotherapy, osteopath, blah, 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 we need to look for homeostasis. Homeostasis is the equilibrium. When you have a good homeostasis, you will not have pain, you will not have disease. However, if you have an imbalance of that, the pain is coming. So we need to restore the homeostasis. And the movement is primordial.
But I think one of the things you just said now is to make a person conscious or make a person aware of that. Do you feel that that's a big issue? Is people are not aware of their problem?
It is. Like, for example, the people, when I advise them, when I ask them, it's like, please, can you move your head? So they do like that. So it means they are not aware of the movement. We need to teach them how.
And if you don't mind, I want to dig into that. Why are people not aware of their problems these days? What is your thoughts?
Probably a lack of education, a lot of time sitting in the computer.
Yeah, I see that there's a sedentary lifestyle, and that just means that people are not thinking about their body in movement. And one of the things you said really early on is how fundamental, how important movement is.
We are made for movement. If you are not moving, you will become sick.
Wow, we are made for movement. Again, if you have questions, please put them in the chat box so that we can answer them and so that you can get some insight information. Certainly an important question is, a person has an injury of some sort. How soon, how quickly should they be coming to a physiotherapist?
Okay, it depends on the stage, but we can treat from the first day. Obviously, it depends on the pathology and of the stage of the patient, but in the first stage, our main goal is to reduce the pain and reduce the inflammation. Once they improve that, the next stage is to improve the range of motion. Next stage, improve the strength, and next it will be improve the stability.
And I think part of that question is that people are in pain already. They're concerned about going to someone that they're going to have more pain. How do you deal with those concerns with patients?
What do you mean?
So a patient is in pain and they've injured themselves and they're having this pain and they're going, oh, I don't really want to go see someone now because I'm in so much pain. How do you approach those first visits because the patient is so sensitive and so sore?
Okay, so obviously from the beginning we need to do a pain threshold, and the patient has to tell us what is your pain, what is your number of the pain, between 0 and 10. And slowly the patient has to be involved on the treatment. From the beginning I cannot do like manipulation very tight or no, it's like the patient slowly have to get involved on the treatment.
Nice. And so that brings people into the treatment right from the first word.
Yeah.
I must be honest, I enjoy that when people are involved in their treatment protocol, because then they're making the decisions. We're not making the decisions for them. I see that one of your specialities is MLD. And I think what we should do is we should dig into what is MLD. I mean, when I first met with you, I didn't know what MLD is, and then you spoke to me and told me about it. So let's get into that. Let's talk about MLD. What is it?
So MLD is a good complementer first for physiotherapy. So the lymphatic drainage massage is a gentle massage to activate the lymphatic system. The lymphatic system is related with the immune system, okay, and is parallel to the blood circulation. It means the lymphatic system is doing the detoxification of the blood circulation, and the detoxification is doing through the lymph nodes. The lymph nodes, they are doing the drainage of the lymph. sometimes these lymph nodes, they are not working properly. Why? Because either they have inflammation, or either because imagine after post-mastectomy, when they remove the breast, okay, they remove some lymph nodes, and after that, for example, the arms become so swelling. So we need to open to help to these lymph nodes that they are not working properly, and to drain the lymph from this part of the body to another lymph nodes that they are working properly. Apart of that, the lymphatic drainage massage is help to the water retention. How many patients we have, especially here in Dubai, it's like they feel heavy, they feel like heavy legs. So this kind of massage, it will help to activate the blood circulation and to restore or push the immune system. Also, the lymphatic drainage massage is help for surgery when you have any kind of injury. And also here, we are specialists, and there are so many patients that are coming when they are doing like aesthetic surgery, like for example, post-mastectomy and tummy tuck. So this lymphatic drainage will help a lot in order to improve the inflammation process.
Nice. I've got a question on that, but I know that we do have a question from one of our audience members, so let's have it.
One of our clients actually want to know, he has a bad knee and hip playing a lot of sport in his early life. So what can you suggest?
What he has, sorry?
Bad hip and bad knee from playing a lot of sports in early life.
Okay. So first of all, we have to do a holistic assessment. So it's just, I will focus on the back, on the knee, but we have to look for the restriction. Okay? And after that, I need to improve the mobility, I need to activate the core stability, I need to strengthen. The patient has to be aware of the movement. And we need to restore the functionality of the human being, the essence.
I certainly see that with people that they play sports in early life, and when they're young, they think they're invincible and they go and do crazy movements, and they don't do warm up, and they don't do cool down, and they don't take care of injuries, and they brush them off. And then as they get older, these issues that they had when they were younger come back to haunt them. Tell us a little bit about that.
We need to move. I mean, for example, I am Pilates instructor, and I am also doing my core stability exercise, and it's part of my life. Okay, I'm pretty sure if I stop to do exercise, I will get injury easily, I will get back pain. So we need always, in all the stages of our life, to do exercise, physical activity.
And I think it's very common for someone to turn around and say, it's just because I'm getting old, or I've got arthritis, and that's my excuse.
There is no excuse for moving. There is no excuse. Always you need to try your best, right?
Yeah. I think that's the important thing is no matter whether you're 1 year old or 101 years old, movement is fundamental of life.
It's life.
And when we talk movement, how would you differentiate? I know I'm throwing you on the spot here, but how would you differentiate from exercise versus movement? The person says, yeah, I'm very active, I do a lot of exercise.
Okay.
How do you differentiate exercise versus movement?
Okay, so this is another issue. It's like, for example, in my consultation, my physiotherapy consultation, I have to do the assessment of the mobility, but also I have to do the assessment of the lifestyle. How are you eating, how you're sleeping, how do you, if you have stress, blah, blah, blah. And to the question is like, are you moving? And they say, most of them, yeah, I am super active. Okay, what are you doing for? Now, I'm walking, blah, blah, blah. It's like, first, walking we cannot consider like physical activity, right? So it's so important. So first, you need to prioritize strength. You need to build up muscle. If you build up muscle, your metabolism will get better, and even you will lose fat mass.
Let's just stop on that.
Yeah.
Let's go back to that. That is so important. I am overweight and I want to lose weight. And you're saying this is so important. You've got to move to do what? You've got to build muscle, and that will help you too.
And you have to be in deficit of calories. But body essence is no math. It's not just be in deficit of calorie, build up muscle, you will lose weight. It's more than that. But like the conclusion, we can say yes.
Fantastic, fantastic. I want to come back to manual and drainage because I think that's an important thing. People have forgotten about the lymphatic system. It's certainly not something that is important, or at least not seen to be important. And what you're saying is vitally important.
Yeah, and these days to boost the immune system. If your lymphatic system doesn't work properly, your immune system, it will be so low. Now these days, I think the immune system is very famous because of the COVID. So we need to boost our immune system. And one of the techniques to improve the immune system, it will be the lymphatic drainage massage. Plus, eat properly, move properly, sleeping quality, stress management.
Let's come to the lymphatic massage. You know, when you use the word massage, I know that people think of, you know, massage.
No.
Lymphatic massage is something
Gentle.
really special.
Yeah.
So explain it in a little detail for us.
Yeah. It's a very gentle massage. It doesn't hurt a lot. It's without oil, because here I heard a lot of things on lymphatic drainage massage. Okay, and it's without oil. Very gentle and very soft. The lymphatic rinse is very slow and very superficial. So, and the pressure is kind of this one. It's very gentle.
So when a person says, you know, they've gone for lymphatic massage, but they are getting deep tissue massage,
It is not lymphatic.
That's not lymphatic.
It's not useful.
No. So when you're on the superficial level, lymphatic.
Exactly.
When you're getting to the muscles, that's a whole
We
nother.
can say sport massage or something else, but it's very lymphatic.
All right, I know we've got another question, so let's have it.
So a client wants to know whether prescribing steroids is something you would do often, like for pain management?
No, at all. We don't believe in the steroids, we don't believe in the painkiller. Of course, we need to look for the cause, why the people are suffering about pain, right? We have to have a good diagnosis. And from the diagnosis, we can treat in a proper way. But we are not so fan of painkillers, steroids, these kind of things.
And why do you say that? I mean, because I know that at this point in time in the world, there are many people that are on painkillers, anti-inflammatories, going further to the corticosteroids.
Exactly.
There are people on pain blockers, neurological inhibitors. I mean, these are common medication that people are on.
I know. And some of the doctors, when they prescribe this kind of corticoids, steroids, blah, 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 is because they need to reduce the pain, or they need to reduce the inflammation of the process. But it's for a short period of time, okay? And it's not the main treatment. Right? There are so many techniques like osteopath and physiotherapy were in order to reduce the inflammation and in order to improve that. And apart of that, for example, there are evidences that the corticoids, when they are doing the corticoids injection, okay, they can provoke an fibrotic of the connective tissue. And in the future, if these connective tissues become fibrotic, is lack of stiffness, can provoke an injury.
But I mean, what you said earlier is pain management is merely the starting of the process. There is so much more that should be focused on. So as you're saying, if a person's on pain medication, they should be on it for a very short period of time. And that should be to allow the process to get into the longer term corrective work, so that the person doesn't have to fall back into those situations again.
Exactly, no.
Give us a time frame. How long should someone be on pain medication for? What would you suggest?
I mean, to be honest, I don't trust in the painkillers. I mean, if you have a good day.
When last did you take a painkiller, ma'am?
Yes, I want to tell you one thing. In the alternative medicine, I advise to these kind of people that in the beginning they are suffering of pain or inflammation, the curcuma.
Right.
So the curcuma, they have a high evidence that it will reduce the pain, the pain threshold and improve the inflammation process.
I think that's a very important point, particularly because we are at the Bioherbal Treatment Centre. We have different practitioners in here with different experience from different holistic herbal points of view. So what you're saying is there are a variety of different alternatives.
Yes,
Are they-
alternative with the high evidence. Yeah.
That's what I was going to get to. So they're not just some voodoo mixture. There are good alternatives so that you don't have to be on chronic pain medication.
And that's why my background in nutrition gives me this knowledge.
Yeah.
How to improve the inflammation process for a person that in order to avoid the painkillers.
Fantastic, fantastic. I know there's another question. Great. Thank you very much for your questions. We're really enjoying them. Let's have the question.
how can physiotherapy help in rehabilitation caused due to football injuries? A client has suffered.
Football injuries rehabilitation. I mean, football is big in the UAE.
Yes, yes.
Depending on which team you prefer. So talk about the rehabilitation for football injuries.
Okay, so there are main pathologies, like for example, the footballers, they are suffering about ACL, okay, meniscus tear. So first, it's like in order to prevent, we have to improve the movement. If the patient they get injured of that or they have a surgery, we need to first post surgery reduce the inflammation process, and after we need to improve the movement, and after we need to strengthen the muscle, and after we have to get the balance.
And in terms of rehabilitation, I think that's where Pilates fits in, and you're, what you've mentioned here, clinical Pilates.
Okay,
again, I think there's another misconception. Okay, I did a weekend course, I'm now a Pilates instructor. This is clinical Pilates. How do you utilize your clinical Pilates?
Okay, so clinical Pilates is me because I am physiotherapist, so I know the anatomy, I know the physiology, I know the movement of the body. So according with the goals of the patient and according with the pathology of the patient, for example, a patient is coming to us and is suffering about low back pain. So we adapt Pilates to the low back pain, right? And the main focus of Pilates is to improve the flexibility. We are working the breathing techniques, we are working the pelvic floor. So I would like to explain you what is the pelvic floor in women's health, so important, and also in men. And we are working the postural control. It's meaning you have a good core stability, your postural control it will get better.
And you mentioned balance regarding football injuries and other sports injuries. Explain balance to us a little bit more.
The balance is like, how can I explain? It's the equilibrium, right? It's like all the joints, we have to have this kind of balance, this kind of equilibrium to avoid the future pathologies.
Yeah. So it's not just about the ankle injury, it's about how the ankle affects everything above.
Exactly.
Yeah?
Exactly.
And you mentioned the pelvic floor. I think like lymphatic massage, there's a lot of misconceptions.
Yes.
I think some people don't even know where their pelvic floor is. And I see that we've got a friend that has joined us for the conversation. Explain to us about the pelvic floor so our people can understand that.
So first I would like to explain you why we should work with the pelvic floor. In Pilates, we are working the pelvic floor. So first I would like to explain what is the core. So the core is like a bell, it's like a cylinder. So top of the cylinder is the diaphragm. That's why in Pilates we are working the diaphragm. The diaphragm is the main muscle involved on the breathing.
So I'm just gonna pause there. She spoke about core and she didn't say anything about the six-pack muscles. She started with the diaphragm. I think there's a huge conversation there. A person says core because I've got nice six-pack muscles.
Nothing to
Okay,
say.
good. Keep going. I like it. Yes.
So top of the cylinder is the diaphragm. Down of the cylinder is the pelvic floor. I'm going to explain. Front is the six packs.
Yes.
Lateral is the obliquous, and in the back side is the low back. So
how many components? Let's go. Diaphragm is 1, pelvic floor is 2, six-pack is the 3, side 4, and other side 4, and then 5 is the back. Let's do the diaphragm, pelvic floor, six-pack, one side, other side, and then the back. And that's 6 of them.
Exactly.
And only one component is the six-pack. I like that.
See, imagine how important it is to have a good core stability.
Yeah.
Alright, so in Pilates we are working the core stability in order to improve the postural control. Okay? Now, what is the pelvic floor? The pelvic floor in the woman's head and also in the men is down of our pelvic. Okay. There are so many people that they are not aware of that, and it's so important. Why? To avoid incontinence, prolapse, and these kind of things. So as we have a training in pelvic floor, so we are working with the screen, with ultrasound. Everything is external, nothing internal. So we are bringing the patient to the consultation, and we are doing a pelvic floor assessment through ultrasound. And like that, the patient, the woman, they will have a feedback how they are doing the contraction of the pelvic floor. The pelvic floor in the screen, it will appear like a line like that. So I need to tell to the patient, please, can you squeeze your pelvic floor? And believe me, there are so many people that they don't know how to do
And
that.
they're pulling a funny face and nothing is happening.
Exactly.
And again,
Only
what you
there.
mentioned earlier is the awareness that the person has of their own body, as in an awareness of where the pelvic floor is, as in I know where it is, but more,
Exactly.
can I access
Exactly. And after, some people, when I tell them, please can you pull up the pelvic floor, or either they are not doing nothing, or sometimes they are pushing down. So this is progress in the future, right? And we are talking about incontinence, prolapse, liquids, blah, blah, blah.
And I think what we need to come back to is you talked about postural control. So we're not just talking someone's got a nice posture, it's that they can control their posture.
Yeah, but we need to involve on that. It's me, for example, if I don't have a good core stability, my position in my office, it will be like that. And I can tell to the guy, please can you sit properly? And after 1 second it will come back again. So this is not the way that we should treat them. The way to improve your postural control is to have a good core stability. I think because I'm working with Pilates, I have a good postural control because I'm working my core stability.
Let me just pause for a moment. If there are any further questions, we'll take it now. I'm going to ask one final question and then we're going to wrap it up. So I know that there's a question. Let's have that.
Can physiotherapy help prevent certain surgeries as well?
Of course, the prevention is of our main technique. I prefer to prevent than to treat. Yes, it's so important. And in this prevention session, we need to involve the patient how the human has to move.
I think one of the things that you said right in the beginning, which is certainly again another philosophical approach of DHTC, is you don't have to have problems or symptoms to come see us. We can certainly do preventative work. Preventative work is not people coming to us all the time. Preventative work is for us to explain and teach people how to look after themselves.
Wellness.
Yes, it's wellness. I think one last question, I think this will be a nice question that you can challenge our audience with. Is there one easy way that a person can check if they've got good postural control? Is there an exercise or a test that they can do at home that can show them?
Yeah, so normally but this is my osteopathic knowledge, okay, and in order to do the assessment of the core stability, I tell to the patient to stand up, okay, and after to put the fingers like that, okay, and after to close the eyes. And there I ask to the patient to up the legs. So on there, he has to be fixed on the same place for a minute. Most of my patients, they are twisted and they are finished in the toilet. So it's mean they don't have a good core stability.
At home, I want you to stand up. I want you to fix your fingers on a point on your wall in front of you. I want you to march for a minute. If when you open your eyes, you are in the same place as where you closed your eyes, then you've got some degree of core stability.
We can say that.
Yes. And if not, then we ask that you come and meet with Elena and come and find out your way of resolution. There is one further question and then we'll wrap it up from there.
So you spoke about lymphatic drainage massage. A client wants to know, what is lymphatic? Is it a tissue or a bone? What is it exactly?
Okay, so the lymphatic system is a parallel circulation, is a parallel system to the blood circulation. And this lymphatic system or this lymphatic circulation are doing the detoxification of the blood circulation. It's so important to have this detoxification. If you don't have a good lymphatic system, you can become sickness. You can have your immune system can drop. You will feel lack of energetic. You will feel heavy legs. You will feel sometimes for example, your arms has become swollen. Yeah.
So it's part of the circulation system.
It's part of the circulation system. And I would like to mention something else.
Yes, she wants to mention something else.
I would like also to tell to the people that I am a scoliosis instructor.
Right.
So I got my certification in scoliosis instructor, and we are treating them through the Scrot method. The Scrot method is a German method, okay, and it's very, very useful. So first I would like also to explain what is scoliosis. I have time for that?
Sure.
Okay, so the scoliosis, what is mean scoliosis? Because this is the typical question that the people ask to me. So this is our spine, right? Here is the cervical. So in the cervical we have a little curvature. We call it lordotic curvature. Here in the thoracic or the dorsal we have another curvature. It's called xiphotic. And here in the lumbar we have another curvature and it's called lordotic. This is our physiology, this is our anatomy, and it has to be like that. However, sometimes the people, and we call it like idiopathic scoliosis because we don't know why, the spine instead to be straight in the frontal view, they got, like for example, we can say the typical scoliosis that mostly I see is like T-right and left, something like that. Okay? So it means your column, your spinal column, has desviation, but it's not just desviation in this view, it's also rotation. Rotation of the vertebra. The vertebrae are the bone of the spine, right? Okay. So what's happened with that? Obviously the person, they will have pain and they will have restriction of the movement. So this scrot method, in this scrot method, we are working through breathing techniques and techniques in order to improve the mobility. Okay? So it's true that the people that they are suffering with scoliosis is probable that they don't have a good mobility, that they will have disc. Okay, the disc is like if you can see the yellow one are the disc. So this disc is coming out of the place and sometimes it's pinching the nerve. And according with this level of the spinal cord, for example, the more famous or the more frequently disc that we have is L5. So L5, when the disc is out of the place, is pinching the nerve, and this L5 is going all the way down. So that's why the people, they say it's like the thin numbness. The numbness is the sensation of the impingement of the nerve. So with the scoliosis, sorry for that, we need to again involve the patient of the treatment. So first we have to do an X-ray, and here it's so important to have an X-ray in order to measure the angle. This angle of the spinal cord is called COP, and according with that, the patient has to be aware of the scoliosis. And once the patient is aware of the scoliosis, we need to involve the treatment through breathing techniques and personal exercise that first they need to start here and after they have to do at home. In Germany, how they work, there are a specific hospital that 24 hours the patient are going there and they get involved in that.
I think what you've just given to our people is a lot of information, and it indicates just how much information Elena has. We are so grateful that you chose time to come and spend time with us and to be able to ask all the questions that you did. Please will you join us in 2 weeks from now as we interview another one of our practitioners. And again, thank you very much, Elena, for such depth of knowledge.
Thanks.
Really appreciate that. Have a wonderful day, everyone.
Thank you.